You stopped using birth control, expecting your period to return. But several weeks have passed, and nothing has happened. Now you may be wondering, did the birth control damage my fertility? Is something wrong with my hormones? Or could I already be pregnant? Keep watching, because the type of birth control you stopped matters. And your missing period may be revealing something that was already happening in your body before you ever started using it. First, take a breath. For many women, a period does not return immediately after stopping hormonal birth control. Your body may need time to restart its natural menstrual rhythm. But before we explain why, there is one thing you should check first. Could you be pregnant? It is possible to release an egg before your first period returns. That means you can become pregnant even though you have not seen any bleeding yet. Your period normally comes about 2 weeks after an egg is released. So if that egg is fertilized, pregnancy begins, and the period you were waiting for never arrives. If you have had sex since stopping birth control, especially without another reliable form of protection, taking a pregnancy test is an important first step. Now, if the test is negative, let's look at what may be happening inside your body. Your brain and ovaries are reconnecting. Your natural menstrual cycle depends on communication between your brain and your ovaries. Your brain sends chemical messages telling the ovaries to prepare and release an egg. The ovaries then produce hormones, including estrogen and progesterone, that prepare the lining of the womb. If pregnancy does not happen, those hormone levels fall, the womb lining breaks down, and your period begins. Hormonal birth control changes this communication. Some methods stop the ovaries from releasing an egg. Others thicken the mucus at the entrance of the womb, or make the womb lining thinner. While you are using hormonal birth control, the bleeding you experience may not always be a true natural period. For example, the bleeding during the pill-free week of some combined birth control pills is called a withdrawal bleed. It happens because the hormone level temporarily drops, not necessarily because your body completed its own natural ovulation cycle. After you stop, your brain and ovaries have to take over the process again. For many people who stop the pill, periods return within several weeks, although regular ovulation can take a couple of months to settle. The type of birth control matters. Not every birth control method leaves the body in the same way. After stopping the combined pill or the progestogen-only pill, sometimes called the mini pill, fertility can return quickly. In fact, pregnancy may happen before the first natural period. The contraceptive injection can be different. The medicine is designed to remain active for months. Even after you stop receiving the injections, its effects may continue, and periods can remain absent or irregular for several months. After removing an implant or hormonal coil, fertility usually returns quickly, but your bleeding pattern may still take time to become predictable. So a delayed period does not automatically mean that your fertility has been permanently damaged. Birth control may have been hiding an older problem. Here is the part many people are not told. Birth control may create predictable bleeding while you use it, but that does not always mean your natural cycle underneath was regular. Imagine that your periods were unpredictable before you started the pill. While taking it, the hormones may have produced regular monthly withdrawal bleeding. When you stop, your old irregular cycle can return. The birth control did not necessarily create the problem. It may simply have been covering it. One common cause is polycystic ovary syndrome, usually shortened to PCOS. PCOS is a hormonal condition that can make it difficult for the ovaries to release eggs regularly. Other possible signs include acne, increased facial or body hair, weight changes, or difficulty becoming pregnant. But PCOS is not the only explanation. Stress can temporarily pause ovulation. Your brain does not separate emotional stress from physical danger as neatly as you might expect. Severe stress, poor sleep, illness, intense exercise, or eating too little can make the body feel that it is not a good time for pregnancy. The brain may reduce the signals that normally tell the ovaries to release an egg. No egg release means no normal hormone cycle, and therefore no period. Large changes in body weight can also affect this process. Other possible causes include thyroid problems, unusually high levels of a hormone called prolactin, breastfeeding, certain medications, and the natural hormonal changes that occur as someone approaches menopause. Pregnancy, breastfeeding, and menopause are all recognized natural causes of absent periods. When should you seek medical advice? Take a pregnancy test if pregnancy is possible. If your period has not returned for about 3 months after stopping most hormonal methods, speak with a qualified healthcare professional, especially if you were previously having regular periods. Do not wait that long if you also have severe pelvic pain, unusual headaches, vision changes, nipple discharge when you are not breastfeeding, or symptoms suggesting pregnancy. A healthcare professional may ask about your birth control method, previous periods, stress, weight changes, and other symptoms. They may also perform a pregnancy test, blood tests to check your hormones, or an ultrasound scan to examine the womb and ovaries. The medical word for not having a period is amenorrhea. It simply means an absence of menstrual bleeding. It is not one specific disease. It is a sign that can have several different causes. The most important thing to remember: stopping birth control does not guarantee that your period will return the next day, or even the next week. Your body may be restarting its natural hormone cycle. The method you used may still be affecting you. Your old cycle pattern may be returning, or another condition may need to be investigated. And remember, you can release an egg and become pregnant before seeing your first period. So do not use the absence of bleeding as proof that pregnancy cannot happen. Pay attention to your body, take a pregnancy test when appropriate, and seek medical advice when the delay continues. Follow Happiness Health Guide for clear, medically responsible health explanations that help you understand what is happening inside your body.